This is an ABP Live Podcast.
Hello everyone, welcome to another episode of your award-winning ABP Live Podcast, Ladies First. And today I am once again your host Niharika Nanda with a very well-known doctor to once again solve all your queries about all your lady problems. जैसे कि हम ऐसे multiple episodes कर चुके हैं where all your basic queries से लेके बड़ी से बड़ी query हमने doctors के साथ solve की है. This is just one another episode of that kind. And today we have with us Dr. Ramya Mishra. She is a senior consultant for fertility and IVF at Apollo Fertility. Hello ma'am, welcome to Ladies First.
Hi.
And you know the best part of such episodes जिसमें हम लोग डॉक्टर से बात करते हैं is that the doctor is also a woman.
Yes.
A woman leading another woman, guiding another woman with all her problems जो कि usually हमको आती रहती हैं. And बहुत बारी इतनी basic छोटी छोटी problems होती हैं फिर भी women are hesitant to
Not
ask
able to
about
ask,
that.
yes.
उनको लगता है कि हमें पूछना चाहिए नहीं पूछना चाहिए किससे पूछे किससे ना पूछें बहुत बारी ऐसे इश्यूज आते हैं एंड टुडे वी आर गोइंग टू टॉक अबाउट एंड ब्रेक डाउन द इंटायर कॉन्सेप्ट ऑफ मेंस्ट्रुएशन में क्या क्या इश्यूज आ सकते हैं क्या क्या बेसिक चीज़ें हैं जो हर वुमेन फेस करती है ड्यूरिंग हर मेंस्ट्रुअल साइकिल एक मेंस्ट्रुअल साइकिल एग्जैक्टली होता क्या है बिकॉज आई एम श्योर दैट देयर आर अ लॉट ऑफ यंग लिटिल गर्ल्स जो कि बहुत कंफ्यूज्ड हैं नहीं बात कर पा रही हैं किसी से तो हम टॉप टू बॉटम हर एक चीज़ कवर करेंगे अबाउट मेंस्ट्रुएशन PCOS PCOD जो भी प्रॉब्लम्स आती हैं विद द वन एंड द ओनली डॉक्टर राम्या सो वेलकम मैम ऑन ABP Live Podcast.
Thank you so much for this nice introduction and let's begin.
Yes.
Whatever questions you have.
Exactly. So the very first question जो बहुत ही basic question would be कि what is the definition of a normal regular period? What is that?
See, as we all know that a female, menstruates, then there is something called cyclical menstruation. Okay, so there are many cases where you see that the cycle length is not accurate. So what do we call as a normal cycle length? See, a female can, the cycle length can vary anywhere from 21 to 35 days. So anybody who has a cycle length between this bracket falls into a normal menstruation interval cycle. So we have to assess, we have to see कि किसका कितना cycle length है. If your cycle length is like 28 days, then the ovulation times varies according to that. Right. If the cycle length is 21 days, then again the ovulation time is different. If the cycle length is 35 days, it's again different. So this is how we see that a normal menstrual cycle ranges between somewhere 21 days to 35 days.
ओके एंड आपने एक टर्म बोली ओवुलेशन सो आप उसके बारे में थोड़ा बता सकते हैं क्योंकि इवन आई एज अ 25-year-old वुमन आई एम नॉट वेरी वेल अवेयर कि एग्जैक्टली ये होता क्या आई हैव हर्ड दिस टर्म अ लॉट ऑफ टाइम्स बट टेक्निकली व्हाट इज इट आई एम नॉट वेरी श्योर.
See, whenever a female starts menstruating, we call it a menarche. So, initially the period cycles, or this is not regular, it's irregular in the initial 1 or 2 years of the cycle, so that your body becomes, regulated to it, your all hormones becomes normal. So, once you start menstruating, a normal menstrual cycle is divided into two parts. The first part is egg preparation time, where it can vary anywhere from, like I told you, from 21 to 35 days. So it can vary anywhere from these like 14 days to 21 days somewhere. So the time period which is taken by a female to mature her egg, which is usually one in a natural cycle, so that duration is called as a ovulation. So your egg matures, it starts maturing from only day 2 or day 3 of the cycles, and gradually it reaches up to a certain size where it gives rise to a small oocyte or the egg, and that is what we call as ovulation, which is very important for a female to get pregnant.
Okay. एंड इसका क्या रिलेशन है एग्जैक्टली पीरियड से लाइक पीरियड्स कम आफ्टर ओवुलेशन इज डन और हाउ डज इट हैपन?
Whenever a female menstruates, then we have something called a fruitful cycle or something called a non-fruitful cycle. Supposingly a female is there and there is intercourse during the time of ovulation, and there is fertilization of the egg and she gets pregnant, so that cycle is called a fruitful cycle. So if she does not menstruate in the next cycle, then we call it that she has attained her pregnancy. So that is what, and in case there is no fertilization of the eggs or there is no implantation of the egg, then she menstruates. So basically there are two fate of an egg when it is there. Either it will be fertilized or it will be not fertilized. So it may lead to either a pregnancy or a non-pregnant state. So that is what, obviously if you are not getting pregnant, then you will get a cycle. So the question was, when do we get menses? So menses is there when you do not attain a pregnancy. So that is called you see your periods after normally a 14 days time is there when you ovulate, and if you don't get pregnant, you will see your periods in the next 14 days or something like that. Right?
Okay.
And if you get pregnant, then you will not see your periods. You will end up into a period of amenorrhea.
Right. And now you told us that what is a regular period and what is the regular duration. What is an irregular period, and why is it caused? Like, what are the basic causes behind it?
See, basically the most important cause of an irregular cycle is a hormonal imbalance. You have two major hormones, female hormones in the body. One is estrogen and one is progesterone. So if there is an imbalance in these two hormones, which is basically by the imbalance between the other two hormones which are there when they prepare you, FSH and LH. So if there is irregularity in the FSH and LH hormone, which will lead to an irregular proportion of estrogen and progesterone in your body, it will lead to an irregular cycles. So we have to assess which stage of menstrual cycle, or why your egg is not maturing at the right time. Suppose in cases of PCO, you have so many eggs in the body, but they don't mature at the right time. Right. Sometimes it may take 2 to 3 months for an egg to mature also. So that leads to an irregular cycle in these kind of conditions. So we have to understand what is the cause. If you have less eggs in the body, then also it takes a lot of time for the eggs to mature, or it may sometimes mature prematurely, not taking 14 days but maybe in 8 or 9 days. So that is why you get irregular periods. If you mature at 9th or 10th day of the cycle, then you will have early periods. Okay. Right. And if your egg matures at 30 days or 40 days time, then you will get a period which is delayed like that. So this is how it goes about. So you have to assess when the egg is maturing.
Right. And for someone who is having a regular period, the monthly, even the dates are correct according to their cycle, but suddenly they miss a period without having intercourse, so they know that they're not going to be pregnant. So that has a very stressful impact on a woman. That why am I missing my period? And they don't, and immediately they can of course they have to take time, they have to take an appointment to go to gynecologist and then check. So what causes that kind of a missing of a period?
Yes, the same which I explained just before this, that why you miss a period. The most common reason when a patient comes to us and says that I have missed my periods, the first question or the first will be think whether you are expecting to get pregnant or not. Despite the marital status or the stage, we go for a urine pregnancy test, which is the most basic test, supposedly, and it turns out to be negative. Then yes, we have to see, is there an ovulation which has happened in that cycle or not, or the uterine lining is good or not. Sometimes there are hormonal imbalances which lead to an anovulation, or there is no ovulation, or there is some other problem. Then also you will end up into amenorrhea, or what you called as missing of your periods. Or sometimes there is endocrine damage also, like your uterine lining gets damaged if you get repeated abortions done, or if you take, if you undergo some vigorous DNC procedures, then your uterine lining gets damaged. There is Asherman's, we call that Asherman's. So because of that, there is something which is not letting your periods to come out. So that is that is also one of the reasons for someone to not get pregnant. Right. Or there are other reasons like you're feeding your baby. If you're feeding your baby, you're into lactational amenorrhea at that time. Right. Sometimes if there is torrential bleeding during post delivery, or we call that postpartum hemorrhage, then also it leads to in some of the cases it leads to amenorrhea, and we call that Sheehan syndrome also. So there are multiple causes. You have to first take the history, you have to analyze what is the reason, then only you can make a correct diagnosis of a missed period.
And a lot of women, even my friends also, a lot of, like, we talk about these things and we find out that even stress a lot of time causes for us to miss our periods.
Exactly.
How are these two things related? Because stress is a very mental thing, periods are a very physical thing. So how does this work?
See, I would say stress is such a thing which causes a lot of changes in your body. Okay, your body has got multiple, it's a complex machinery,
right,
which has got multiple things into it. Your brain has got something to do. Your brain releases some hormones.
Right.
So stress basically affects your brain. When it affects your brain, there are certain hormones which are produced, which will ultimately lead to irregular cycles. Change of seasons can also lead to these kind of things. So this does happen, and we have to if you're not taking proper food, you must have seen some ladies, some girls who are very cachectic. They are very thin, lean built. They will be having menstruation problems. Definitely you must have seen females who have very heavy built females, so they also have these kind of problems. So this because your fat also has something to do with your estrogen levels. So this ultimately your physical your body, your stress levels, your medical status, this all impacts the your cycles, how it goes on.
Right. So it could be stress, it could be a change of season, it could be anything and everything that impacts you in some way or the other.
Because it is not just a menstruation, it has nothing to do only with your uterus.
Right.
It has to do with right from your brain, it has to work from there.
Right.
We call it HPO axis, hypothalamo pituitary ovarian axis. So there is an axis which is there, so it works out that way. अंदर है
कोई बात नहीं,
दबा दो, कहीं से दब जाएगा। काट दो
बस एंडिंग वाला रिपीट कर, जो हाइपोथैलेमस वाला पार्ट है वो वाला।
We have something called hypothalamo-pituitary ovarian axis. So this itself indicates that your hypothalamus, which is there in the brain, your pituitary, which is also there in the brain, and your ovaries, they work in collaboration. तुम ऑफ कर दो ऊपर से करके, लाओ भी कर, हो गया, ठीक है,
वही वाला पार्ट फिर से।
We have something called hypothalamo-pituitary ovarian axis. So that itself indicates that your hypothalamus, which is there in the brain, your pituitary, which is there in the brain, and your ovaries, they work in a fashion, they work in a synchronized way. So if you are stressed out, definitely your brain gets affected. There are certain hormones which get affected, and ultimately it may lead to irregular menstrual cycles or other things in the body.
Right. Okay. And there is another thing जिसके बारे में काफ़ी confusion है and काफ़ी लोग they think कि it is a part of it or not, बहुत confusion है इस चीज़ को लेकर, PMS. So उसके बारे में आप हमें बताइए कि क्या क्या होता है PMS में, and what all different things can women go through, and कितनी पहले usually होना शुरू हो जाता है before the periods. Can you tell us a little about that?
See, there are multiple females are very different. All the females are different from each other. So there is a term called premenstrual syndrome. Okay,
Right.
so it's a very broad spectrum. It's a big term where you can incorporate everything, right from mood swings, right from pain, right from anxiety, depression, weight gain. There are multiple. It's very big spectra, like I told you.
Right.
So some of the females may experience these symptoms. Some may not experience these symptoms. Some may have a very bad cramps. Okay, so very bad cramps, so that the whole family comes to know that she is undergoing menstruation. So these girls may later on have something called endometriosis in their body, or adenomyosis sometimes. So we have to see what is the reason for, something is mild symptoms are acceptable, but if you have severe symptoms, then yes, you should definitely go and see some clinician for that, why is this happening this way.
Right.
Otherwise, if you talk in broad spectrum, most of the females, I would say 85% of the girls and the females, if they are counseled properly about that you are going to get your periods, or you are going to attain your menses now, and you may experience these symptoms, these things, then they accept it in the way. Right. So mood swings, you may have, you feel like having chocolates, it's fine, you go and you have chocolates, because that is something which is a stress buster for you. Okay, so this is what I say, that if you let a girl or a woman know that these are the expected symptoms which you may have, so they may accept the premenstrual syndrome also. Provided there is no organic pathology, there is no problem in the body itself, it's too much of, you are having big fibroids in your uterus, and that is why you are having painful periods, then yes, you need to do something for that. But if it is a milder one which is acceptable, that is okay to go for.
Okay, and talking about pain, as you said that a lot of women even during PMS go through cramps, and even during periods they go through cramps.
Yes, that is called a premenstrual. See, when you are getting a periods, it is because of the withdrawal of the hormones which happens in the body. That is a hormonal phenomena.
Right.
But you have something called endometrium in your uterus, and that endometrium is the one which has to shed in every cycle. In order to shed that cycle, your uterus undergoes certain spasmodic movements.
Okay.
Some contractions are there in the body. So those spasmodic movements basically lead to these painful things, which we have cramps. So once, some of the females experience these pains before the periods. So that we call as congestive dysmenorrhea. It is premenstrually there.
Okay.
Once it is released, once you start getting your periods, your cycle is, your blood is flowing properly, then you are relieved of that.
Right.
So that is called only premenstrual dysmenorrhea is there, and she is fine now. Some of them experience this in the two phases, like in the premenstrual also, during the menstruation also. That is something which is there, which is to be seen.
Right.
And some of them experience that in later part also. So that is called a triple dysmenorrhea. You have a premenstrual, a menstrual, and a postmenstrual as well. So I would say that the commonest one is the premenstrual, which most of them have.
Yeah.
Okay. So once you have if you undergo, I'm talking of some ladies. If a girl is there or lady is there who conceives and she is giving rise to she has got a normal delivery, then the congestive dysmenorrhea is usually settled. Okay. Because there is a passage which is there, and she has delivered one kid from there. So it's easier for the menstrual blood flow to come out. So then the pain becomes lesser. But supposingly you undergo a cesarean section, so the passage is definitely not dilated that much, and you have still that small orifice which is there, and the uterus is trying its hard to throw the blood out.
Right.
So that is how you have these. So you have to understand that which phase. So when we ask patients about the dysmenorrhea history, we ask all these factors. We take all these factors into account and then see how painful, why she is experiencing so much of pain. Is there some obstruction? Is it only spasmodic? If it is only spasmodic, mild antispasmodics may help her. So that is not to be worried much.
And what can we do, like painkillers or heating pads? Mostly,
yes.
stuff
You
like
can
that.
you can always do that just to make you comfortable. There is no need to suffer.
Right.
Okay, there's no need to suffer. You can go for mild painkillers. We usually advise a 3 or 5 days of antispasmodic if somebody experiences a lot of pain. So that is okay. That is okay to take. Not a problem.
And what is the right duration of a period? Like a lot of women go through it for 7 days, some for 5, some for 3, and even some for 2 or 1. So what is the normal duration of a period?
We usually say it's a 2 to 7 day cycle.
Okay.
Which is a normal one. You can have anything from 2 days to 7 days is absolutely okay. Less than 2 days is considered as a scanty periods, and more than 7 is a prolonged cycle, right? But if you menstruate for 5.5 days, 6.5 days, it is absolutely fine. There is no problem in that.
Right.
So as long as the cycles are regular, the length of the duration of the bleeding is fine. There is no problem.
So even if someone has a scanty or a longer period, also if it's regular,
Yes,
then it's
is
normal.
more important.
Then it's not an issue.
Yes.
Okay. And another thing that is making rounds on the internet these days, and a lot of people are pro and against it, is period sex. So is it advisable to have sex during period? Is it not?
See, this is something which I would say that because you are bleeding, you have a vascularity at that time. Your organs are soft. It is not comfortable also. So if you go for a sexual intercourse at that time, you are more prone to infections. Okay. You have a softer lining which is there. So softer vaginal lining which is there. It's more vascular.
Right.
So you may have some breaks, some cuts, and you are more prone to infections as well. Okay. So it is generally not advisable to go for sexual intercourse during periods. But yes, if the flow is less, you are the later part of it, yes, you can go for it. But generally speaking, it is not comfortable also and not advisable as well.
Right. Okay. And talking about irregular periods, बहुत लोग होते हैं, like, and there are aunties in the family and everyone, बेटा ये खा लो, बेटा ऐसे कर लो, periods ठीक हो जाएंगे. So are there certain foods or are there certain exercises that women can do to sort of keep their flow regular and periods regular?
I would say no, there's nothing like that. It is all we all need to go for a healthy lifestyle. We all need to go for something nutritious in our diet. Like we have increased our, junk foods are too much in diet these days. So there is no certain food which is to be avoided. ये अचार नहीं खाना है, ये नहीं खाना है. Nothing like that.
Right.
This is completely a I would say misleading. Yeah, these are not things to be followed. So you can have your normal regular cycles. It is a physiological phenomena which every female on this planet is undergoing. So you need not consider as if you are undergoing something which is made by nature only. So nothing is special. You all perform your duties. We are seeing ladies these days, girls these days, they are going on different planets. So why not? I mean, this is nothing to cut yourself like I cannot do this work or that work. We all have to be very normal in that sense.
And coming to issues related to periods and menstruation, like you also mentioned, PCOS, PCOD. Again, बहुत confusion है इस चीज़ के आसपास. What is the difference? What are the symptoms? When should a woman get herself checked if she is facing either of these two? So can you tell us a little about it?
See, like I told you, when a girl is born, we all have specific number of eggs. We have limited number of eggs. That can be any number. That number can be less, that number can be more. So if that number is appropriate, it is fine. But some of the ladies, they have got more number of eggs, which is more than normal. So there is a competition between the eggs and none of them matures. So that is called basically polycystic ovary. Okay, and polycystic ovary is also like like I told you in the initial part that we have a 14-day cycle, which is a natural cycle, which is a normal cycle for anyone to get a mature egg in the body.
Right.
But in case of PCO, this may vary from anywhere 2 months to 3 months.
Okay.
So you may not be menstruating every month in these conditions. You understand that thing?
Right.
That once your egg is not maturing, you will not have a 12-month, 12-month में 12 periods wala thing.
Right.
You will have a 3 to 4 cycles in a span of 1 year. Okay. Because you are because your egg is taking a longer time to mature. Okay, so that is the main problem with PCO, and that is why these patients find it difficult to conceive, because they cannot find out where is the ovulation time, where is the fertile window. They will be having lesser number of fertile days.
Okay.
And the quality is also compromised slightly in these cases. But as far as fertility duration is concerned, like usually we say up to 35 or 36 your eggs are fine mostly. But in PCO patients, this may be a longer duration.
Okay.
So as far as infertility is concerned, we always say that PCO patients are good, are fine.
So
yes.
they would not face
Yes, they will have a better
so easily.
fertility. Yes, they will have a better fertility in the later part of life also. So it's a good thing for us if you are PCO and you have. So you all should know when like if you have longer duration of cycle. So we should diagnose why is this lady getting her periods in a 3 months or 4 months duration. Why is this girl getting? So there can be two reasons, like I told you. There can be the egg number can be too much, or there can be very scanty number of eggs.
Right.
So both the things have to be diagnosed carefully, very carefully. The symptoms can be variable anywhere. Like if a girl comes to me who is overweight, who has got some hair kind of structures, or you have got a longer amenorrhea period, the first diagnosis which comes to my mind is PCO only. But confirmation is important.
Right.
Confirmation is very important, and the first step of treatment of any PCO patients comes out to be a weight loss.
Okay.
If someone loses weight, then it is said that 70% of the time without any medication they will start having the regular cycles.
Okay.
So again the lifestyle comes here again. So PCO, if you have been told that you are a PCO, get it corrected that yes, you have been diagnosed correctly at a correct by a correct person, and then you can sit back and plan your pregnancy as per your as per your own wishes like that.
And why, like you explained in general PCO, so what is the difference between S and D? Like a lot of people face PCOS, some go through PCOD. So what is the difference?
It's a very confusing. There is no clear differentiation between this. Syndrome, PCOS basically syndrome. Syndrome is something which has got a broad spectrum. Okay, so broad spectrum maybe we may have many patients like lean PCO. We may have thin which called lean PCO. You may have obese PCO. So this is like it may vary. There are multiple symptoms they have given.
Right.
Rotterdam criteria is there, so they can be minor symptoms. Major ones can be there. You may have foldings near your neck. Okay, that is called acanthosis nigricans that is called. You may have mustaches, you may have acne all over your body, you may have longer periods. So this all makes a spectrum of syndrome. So when S comes, it is as a syndrome. Okay, disease, it is per se not a disease. I would say it is not a disease per se, but it is a condition which is there.
Right.
So it is better to put it in a syndrome. Syndrome is a better terminology for that, I would say.
And in general, like irregularity in periods, का जैसे आपने causes वगैरह बताए हैं सब कुछ. So how does it affect fertility? Like PCO तो we understood that it is actually better fertility wise, and it gives you a longer period for conceiving as well.
Life.
So someone who is just having some basic irregularities in their periods, maybe missing a period for a month, but then it comes back the other month. So how does that relate to fertility? Is there a risk? Is there no risk? Everything can go on smoothly? What is that?
No, irregular cycle is a red flag to you.
Okay.
You know, if you have irregular cycles, it is important for you to understand why it is irregular. Is there some thyroid problem? Is there some prolactins are high? Is it some amenorrhea which is happening from the body? So we have to understand the cause of that irregular cycles.
Right.
Because if you have irregular cycles, it is difficult for you also to understand, to track your periods, to track your fertile window also.
Right,
You know,
right.
it is important. So that will affect your fertility later on, definitely.
Okay.
So once you have irregular cycle, you should know the pattern. You should start tracking your periods. You should start tracking your multiple softwares are available, multiple applications are there now. So you can always track them, number of days, when did I menstruate at that time. So, or if you are married and you are planning for a pregnancy, then yes, you should take a step forward early to find out. You can go for follicle monitorings, or you can see, you can check with your, now kits are also available, when are you ovulating, so that you can try at that time and you avoid any kind of, because it is not only about getting, 28-day cycle, 14th day I will try and I will get pregnant. It is not like that. So because the egg has got a very short lifespan.
Right.
So that is to be understood, that you are having intercourse with your husband or your partner when you are actually ovulating. That will only lead to a fruitful pregnancy. Okay. So that is why the importance of regular cycles are there. Once a regular cycle, so you know that this is the time of ovulation, I can have intercourse and I can get pregnant. But with an irregular cycle, you have to be doubly sure when are you doing that.
A lot of questions that I did a Google research on what kind of questions women usually have around menstruation, and एक और question जो था जिसे आपने scanty periods के बारे में बताया. So a lot of women go from good periods like 2-3 days to then scanty periods. So is that also a red flag, or can that be normal if it's a regular cycle?
As your aging starts, you have a different spectrum of different hormonal levels in your body. Okay. So you have got very good periods when you were 20, 25, you had a cycle length of 3-4 days, 5 days, 6 days, and gradually when you are approaching your 30s or 35s or late 30s, you are having lesser number of days of your cycles. So that is, I would say, that is if you have completed the family, it is absolutely okay, no problem. Okay. But if you have not completed your family, please go and check with your fertility specialist or with your gynecologist what is the hormonal levels in your body.
Okay.
If you have a thinner endometrium, if you have a thin lining, you will definitely have a scanty periods, or less amount of bleeding will be there.
Right.
So this is to be understood, that with time you may have some changes in your cycle length, yes, but you have to understand from the fertility point of view, where do you stand. If you have completed your life, family, your everything is fine, then it is fine. You can go and check. That is absolutely acceptable and understandable also, that at 40 years of age, yes, I am going to have less cycles or less number of days of bleeding. That is okay. But if you still have to plan it out, or you are getting late married, then you have to go and see that is there any other problem. Sometimes I have seen that females, we don't know, it's very common in India to get a tuberculosis infection. Okay. So if you have got tuberculosis of genital areas, genital tuberculosis is there, then you tend to have thin endometrium. It gets eaten up by the bacteria. So then also you may have a lesser period. So go and check with your specialist or your gynecologist that where do you land up, where are you standing at present.
And this can happen at a younger age as well?
Of course, yes. It can happen at any age, because reasons can be n number of them there. So whichever age you are, supposedly at 25 only you're feeling only 1 day or 2 days of cycles, you need to go and check. You need to get an ultrasound done and see the thickness, at what time of cycle you have, how much of thickness is there, because that will definitely affect the amount of periods you see.
Okay. Now that we've talked about menstruation in general, can we talk about menopause a little, and what kind of symptoms are there when you are going to go through it, and how can you predict, or whether or not you can predict a little about that?
Yeah. See, like I told you, when we are born, we have limited number of eggs, and that can vanish anywhere from 30 years of age. From 30 to 35, there is a fall. From 35 onwards, very fast fall is there. So, if you're approaching the perimenopausal age group, which is nearly, I would say, 40 plus, like you are 40 plus, 42 years, 43 years. So, this is the time when you slightly see changes in your menstrual length, menstrual cycle days. So, this will give you an idea that yes, earlier I used to have at a regular period of 28 days, now I'm having at 35 days.
Right.
So, yes, there is a delay in the maturation because of some hormonal changes which may be decreased number of oocytes or eggs in the body. So, you may have, like, it does not abruptly ends. We all have to understand that menopause does not, you don't attain a menopause abruptly. It will gradually happen. It is a phase, it is a phase which is there. So, that is why we always say that a menopause is a diagnosis which is made in retrospective.
Okay.
Okay, you cannot say that I have not seen my periods for the last 4 months, now I have attained menopause. No, you have to have a period of 1 year of amenorrhea to get this diagnosis made. So the definition itself says if a female does not see her periods for a span of 1 year, which is who is in a perimenopausal age group, or maybe earlier, maybe in 35s or 40s. So if that 1 year period she has not seen, even a spotting is there, then we call it as menopause. If she sees her periods in a span of 6 months, and then she sees her periods, then another 3 months she sees, so she has still not attained menopause, but yes, she is in the perimenopausal age group.
Okay.
So that is to be seen. You may have some mood swings, like after menopause you have less hormones in the body, like estrogen reduces in the body, so you may have mood swings, depression, anxiety may be there. You may have the feeling of restlessness. Your bones also start weak, and you may feel very irritable also sometimes.
Okay.
You have to understand that these are the changes which everyone has to undergo. So if you, like, a menarche is there, then also you have multiple changes happening in the body, and at the time of menopause also you have these changes happening. So accept those changes gracefully. This with age, this we have to, like, we definitely expecting these things to happen. So you can always let your family members know that you are facing something, so they can come and help you out. And once it is a complete menopause, then you can have some of the females, some of the ladies, they can go, if you're feeling a lot of symptoms there, a lot of depression, anxiety, then you can ask your gynecologist to prescribe you minimum number of medication, minimum hormonal tablets, so that you see your periods at some intervals of time, and you don't have those symptoms which are bothering you. But if you can accept them, if you can understand that yes, I am going through this phase and I am having that insight is there in you, you can very well tide over that phase. So that I would say.
Right. Okay. Thank you so much, Doctor, for joining us today and clearing, I'm sure, a lot of girls and women's doubts out there, because I am also one of them. A lot of them are out there who have so many doubts, so many questions, and I really hope that this conversation of ours and insights that you've shared with us, unse unko thodi si help ho, thodi si clarity mile about the problems that they're going through. And as you also said, when there is a situation of a question mark in your head, either talk to someone or just as simple as visit your gynecologist.
Yes.
कहीं भी कुछ irregularity आती है, कहीं
Don't
भी pains
ignore,
ज़्यादा होती है.
don't ignore
Exactly.
your symptoms. Don't ignore yourself. You have been blessed to be a female in this world. So we all should accept that we have certain changes happening, and then you can always address them and take help from your people.
Exactly. It's always better to get it checked, because again, cure is
prevention is always
prevention is better than cure.
Always better than cure.
Exactly. Perfectly said. Thank you so much for joining me today,
Thank you so
Dr.
much
Ramya.
for asking me to come here and join this session. I also enjoyed it thoroughly.
I'm so glad, and keep listening to Ladies First on ABP Live Podcasts.